today we're going to be working with Dr. Cassie, particularly in her pelvis and her sacrum, to help with any pelvic hip pain and sciatic pain that can develop as obviously pregnant moms go through gestation. Hey everybody, Dr. Luke Stringer here, Advanced Health Chiropractic down in South Loop, Chicago. Stand next to my beautiful wife, Dr. Cassie Stringer. Dr. Cassie Stringer is obviously 34 weeks pregnant with our second baby, and she's still in the clinic treating patients, getting it done. But today we're going to be working with Dr. Cassie, particularly in her pelvis and her sacrum, to help with any pelvic hip pain and sciatic pain that can develop as obviously pregnant moms go through gestation, as you grow a baby. Obviously your hips, your sacrum shift. When that happens, it can create compression on the nerves within the lower back and the pelvis, which can create that pain that shifts out your lower back, down your leg. The key to this is getting ahead of it early. Dr. Cassie is a chiropractor. She's been getting adjusted 2-3 times a week through her entire pregnancy. Research is clear. Moms who get adjusted do better when it comes to birthing time. So Dr. Cassie isn't really struggling with sciatica per se, but she's having a lot of hip and lower back pain. She's 6 weeks from giving birth. So essentially this is how we've been addressing that hip and lower back pain and any sciatic pain that occurs. So let's go. So we use this pregnancy pillow. This is designed obviously with a big hole in the middle for the belly and protect baby there. It's still pretty tough for our pregnant moms to lay on the front, obviously for what we've got going on. The first thing we're going to do here is check leg length alignment, and we can see in Dr. Cassie's right side it's shorter than the left side, and you can see her hips up, kind of shifting up, and it's rotated. So this hip joint needs adjusting. I like to use drops when it comes to pregnant moms, particularly in the pelvis, just easier to get a good adjustment. Stabilize left hip, we're going to just drive through that hip. Now some of you might be asking, is it safe to drop the pelvis when you're pregnant? Absolutely. That baby about the size of a cauliflower head right now, and he's obviously surrounded with all the amniotic fluid. So essentially, he's got more than enough protection. We evaluate that, we clean that out. She's still got a little bit of a leg length discrepancy, so we're going to check her pelvis, her sacrum. So what I want you to do, Dr. Cassie, is lift your right leg up for me, down, left side. And you see that this left side is moving more than the right side, so this indicates that she has a shift in her sacrum. We're going to come right into that sacrum here. Good. The last check we're going to see is just evaluate how that sacrum moves. We're going to bring the legs up. And she's got a lot more restriction on this left side, so we're going to adjust this pelvis to here. Okay, that's doing a lot better. And then last thing we're going to do here is just evaluate the lumbar spine, and we're just evaluating it for motion. And she's got a big shift at the third level and then the first level, so we're going to adjust that. So Dr. Cassie, you're going to lay on the left side for me. Let's shift this for you. Yep. Now obviously we modify how we adjust the lower back a little differently, because obviously we've got the baby sitting right there, so we're just going to come through that joint. There we go, good. And you're going to lay on this right side for me. Yeah, you got it. Bring this through. We're going to come right up into that first level. Rotate. Good. Onto your back for me. Grab my elbow. Reach me. Oh, you got it. Alright guys, so essentially that's an adjustment that we're doing with all our pregnant moms, obviously Dr. Cassie, to work on that pelvic hip alignment to eradicate the sciatic pain. Hopefully you liked it. If you're watching on YouTube, subscribe, turn on notification bell. So on Instagram, follow us back, like the video. Look forward to seeing you on the next one.